Hello, today we're going to talk about medication management of menopausal symptoms. This is part 3 of menopause and perimenopause symptom management. So basically going through it again, it is often starts when your ovaries stop producing estrogen, progesterone around your 40s and 50s, generally most commonly seen between 45 and 55, depending on a lot of factors like lifestyle, genetics, and what other medical conditions you've had. This does not include women who have premature ovarian failure when they go into menopause early or who have had hysterectomy. Then, symptoms can be quite debilitating. It was not something that wasn't addressed in the past. Women didn't understand what was going on through their body, why their mood was all over the place, why they were more upset, why they were more anxious or fragile emotionally, why they experienced these hot flushes, which is basically a sudden feeling of feeling hot, like flushing or sweating that happens with no particular reason, even if they're sitting in an aircon. That is hot flushes, and it does affect them, impact their function, and they try to cope with it. So nowadays we have medication management of these symptoms. The most commonly used one is hormone replacement therapy. Depending on, I as a doctor, depending on the severity of the symptoms, suggest medication or non-medication management. Now, disclaimer, you should talk to your doctor because hormonal or non-hormonal, or for that matter, any medication is prescribed based on individual benefits, symptoms, and side effect profile, and if it is suitable for you. For example, there are risks involved in taking estrogen and progesterone, and there are benefits as well. So your doctor may be able to weigh these risks and benefits, speak to you, and then you can have a common decision made which suits and what is of most benefit to you as a patient. So please do consult your doctor. Do not Google the symptoms and decide, okay, I told you these medications work, so you should go and take them. No, that's not how it works. Please don't do that. ChatGPT and Google can tell you a lot of things, but experience and individual assessment of the patient is a professional skill, and you should go and speak to your doctor and not take general advice on these things. These are things that have risks involved in them. Okay, so now going back to hormone replacement therapy, the most common hormone replaced is estrogen. There are other hormones, progesterone and testosterone as well, depending on the severity of your symptoms. So estrogen lack of estrogen gives you symptoms like vaginal dryness, and gives you symptoms like mood changes. Generally, your skin does not look as young as it used to be. You have more wrinkles and things like that. There is more anxiety, vulnerability. There is sleep disturbance. There's also bone aging is accelerated as well. So you get osteoporosis when your progesterone estrogen levels drop. So that's why this is beneficial. The risk of fracture in a postmenopausal women or woman after menopause is much higher. So that's why hormone replacement therapy comes in handy. It's generally prescribed for about 5 years from your start, and started in about, if you have not had menses for about 12 months, that's when you decide you are defined as someone being in menopause, and that's when hormone replacement therapy kicks in. You can take combined hormone replacement as well. So combined replacement is prescribed to women who still have their uterus, because unopposed or estrogen alone prescribed can cause thickening of your endometrium and increase your risk of endometrial cancer. Now, estrogen has to be taken with caution in people who have had clots in their body, who have had previously breast cancer, who have migraines, with certain types of migraines. They need to be careful when they take hormone replacement therapy, and a combination is given if you have your uterus intact as well. Side effects, Progesterone can cause a lot more side effects than estrogen. Estrogen does help you with your skin as well. It can cause bloating. It can cause bloating, headaches, mood swings, and vaginal discharge. Sometimes it can cause breast tenderness. It can cause diarrhea. And constipation. So you have to weigh these side effects and decide if it is for you. So that's why talking to your doctor is important. Now, there's a new medication called Tibolone, which is a synthetic steroid, and these are all steroids. The synthetic steroid that can give the benefits of estrogen, progesterone, and testosterone, and it's newly been approved in Australia to take for menopause. It has the added benefit of giving you bone protection as well. Now, there is studies that was done. I think it's a LIV study that said it does increase your risk of cardiovascular conditions by 2.8%. Than a normal population or people who don't take it. It can also increase your risk of endometrial cancer. So these have to be weighed. It's not like a that needs to be considered and excluded as an option. You need to speak to your doctor, weigh in your risks and benefits, and then decide if it is for you. Generally prescribed only for 5 years though, because the risk goes up after that. You've got to remember that once you stop these medications, your menopausal symptoms can return. Your risk of heart conditions can go up, because after menopause, women have equal risk of heart conditions as men, and our hormones protect us longer than men. What else? Your risk of osteoporosis or fractures go up. So bone replacement therapy is an option if that is the reason. Vegetarians tend to be, vegans tend to be more at risk of osteoporosis. So treating osteoporosis is an option. Now, if you have mild symptoms like hot flushes and it's not that severe, then going for non-hormonal therapy is an option. Before going into that, I will talk about some of the topical hormone replacement. Topicals are, you can have pessaries, which is inserted into the vagina 1 or twice a week. You can have patches, which release lower quantities of estrogen as a replacement, especially for things like vaginal dryness. It's very beneficial. And you can also have gels. You can apply up to 4 pumps in a day to manage your symptoms, and I have had fantastic results with the topical gel preparations, then the pessaries and the patches. So do speak to your doctor about these. Non-hormonal, there are SNRIs, that is, these are antidepressants, SSRIs, these are also antidepressants. They work well for things like hot flashes and mood symptoms. So fluoxetine, escitalopram, some of the other SNRIs like desvenlafaxine, venlafaxine, they're excellent if your symptoms are not that severe and you don't have a large symptom profile. This is a consideration to manage your symptoms. So lifestyle, I believe lifestyle modification, complementary therapies such as, hypnosis, acupuncture, although they're considered to have some placebo effect, they do work. Counseling for your mood symptoms, when they all work together is when you can get the maximum benefit out of these treatments. That 5 years when you're going to be on hormone replacement therapy, I highly recommend women to work on their well-being, to get into a exercise program, to get into a healthy lifestyle, and other things like managing stress, getting into the practice of avoiding things that cause you stress, and managing your mood and well-being in a better place that suits your lifestyle, suits your body and your mind. When all of these are working together is when you get the most benefit out of this. I hope you found this talk beneficial. Even if you took away one thing, I think this talk would be productive. Do ask me any questions that come up to your mind, and I'm more than happy to answer them. Do let me know if there's any other topics you want me to talk about, and I'm more than happy to do that as well. I hope you have a great morning. Thank you.